to look at the mechanism of action of the common anti-epileptics. So under this, firstly we'll start with questions. First question is name some sodium channel blockers. Name some sodium channel blockers which help in the same, that is in case of anti-epileptics. So the second question is GABA A channel blockers. The third question we want to ask is the same, that is the synaptic vesicle glycoprotein. The synaptic vesicle glycoprotein 2A inhibitors. So you'll find out these answers in this video, and at the end of the video there are some questions as well. So to get started, firstly sodium channel blockers. So under sodium channel blockers, this includes, there is the phenytoin, then comes the carbamazepine, next there is also the oxcarbazepine, eslicarbazepine, there is also the lamotrigine, then topiramate, felbamate, valproate, and rufinamide. Now moving further, we are looking at the sodium channel blockers, the calcium channel blockers. So under the calcium channel blockers, this includes, there is the valproate as well as the lamotrigine. Next there is also the ethosuximide. Next we are looking at the GABA A receptors modulators. So under the GABA A receptor modulators, so under this it includes the benzodiazepine and the phenobarbital, felbamate, primidone. Next there is also the topiramate, carbamazepine, oxcarbazepine. Then there is also the stiripentol and the clobazam. Then we move on to the GABA uptake inhibitors. So under the GABA uptake inhibitors, this includes the tiagabine as well as the vigabatrin. Next we move on to the synaptic vesicles. A synaptic vesicle glycoprotein. So here there is a 2A inhibitors. So under this it includes, there is levetiracetam as well as the bivaracetam. Next what we see is, there is the NMDA receptor antagonist. So under this NMDA receptor antagonist, it includes, there is the felbamate. Next we move on to the PA, or the kainate receptor antagonist. So under this it includes, there is the phenobarbital, there is also the topiramate, next there is also the perampanel. Then we look at the HCN. The HCN channel activity enhances. So this, it includes the lamotrigine. So the lamotrigine is included here. Then we look at the inhibitors of the brain carbonic anhydrase. So the inhibitors of the brain carbonic anhydrase. So under this it includes the acetazolamide. Then there is also the zonisamide and also the topiramate. Then we look at the potassium channel openers. The potassium channel openers. So under the potassium channel openers, it includes, there is the retigabin, and also the topiramate. So now we move on to answering our questions. The first question we asked was, name some sodium channel blockers which help in the epileptic property. The sodium channel blockers. So this includes, there is the phenytoin, there is also the carbamazepine, next there is also the oxcarbazepine, eslicarbazepine. Then as we move on, there is also the lamotrigine, topiramate, ophthalmomate, then also there is valproate and the rufinamide. So they are under the sodium channel blockers. Then we look at the GABA. GABA A receptor modulators. So under this there are the benzodiazepines, there is the phenobarbital, there is also the felbamate and the primidone. So beyond this there is also the topiramate which is present. So there is also topiramate, there is also the carbamazepine, then there is the oxcarbazepine, then there is also the stiripentol and the clobazam. So the next question we asked was, the question 3. We asked was, what are the synaptic vesicles? What are the synaptic vesicles? This is the glycoprotein. Synaptic vesicle glycoprotein, that is a 2A inhibitors. So under this it includes the levetiracetam as well as the brivaracetam. So they are included under this. Now we will look at some bonus questions. So the questions we want to ask is, first question is, name the calcium channel blockers with the anti-epileptic property. That will be our question 1. The second question will be, name some GABA uptake inhibitors which have a role in epilepsy. The third question we want to ask is, name some NMDA, name the NMDA receptor antagonist. which has a role in anti-epileptic property. So you can answer these questions in the comments.